St. Louis area hospitals experience a record number of COVID patients while bracing for an overwhelming number of cases in the coming weeks. The St. Louis Metropolitan Pandemic Task Force reported more than 1,100 hospitalizations in the first week of January and climbing, saying it's the nightmare scenario they feared.
The scary part of this situation is the number of patients coming in and needing hospitalizations is challenging our ability to provide care to everybody that needs care right now. We have stopped doing elective surgeries. Many of the adult hospitals are not going to do an elective surgery, right? So you might think that is that really that big a deal? Well, yeah, think about maybe your grandparent who needs a total hip replacement or a knee replacement because they hurt so bad they can't really get around. That's an elective surgery. That's going to make their livelihood better. They can't have that right now. And that is a super huge impact because that means other people might get pushed back. That means you don't know when that's going to happen. This is a big deal. It's a big deal.
Dr. Jason Newland is a pediatric infectious diseases physician at St. Louis Children's Hospital. He's also principal investigator of this COVID-19 research study taking place in some St. Louis area middle and high schools. The study involves community testing and weekly COVID-19 testing with study participants. Tests involve those who are vaccinated and those who are not.
It's busy. It's extremely busy for everybody. And the curve is not a curve. It's a straight line up. It's a complete vertical line right now. I mean, that's what the hospitalizations have done. We're going to reach a peak in the next couple of weeks, but doesn't mean that the cases just go away. We'll just start seeing less of them. And so we'll then go down the other side of the mountain.
Having this perspective and now experiencing the worst of COVID from the Omicron variant at St. Louis Children's Hospital, Dr. Newland is more passionate than ever about COVID-19 vaccinations.
First and foremost, vaccinations have worked. They have prevented serious disease, and they continue to limit the number of people that end up in the hospital. However, not everybody's vaccinated. And there are people who are vaccinated that don't have the same immunologic response, so that get the same protection, and so therefore are at some risk of being infected. When you have a variant such as Omicron that is just able to infect more people, it's more transmissible. So these young children who have really been spared, though they've been infected, right? We saw some more in Delta. We had a little bit rise. Now they're getting a lot more infected. And so that's another group unvaccinated that some have ended up in the hospital because they're little and sometimes they have fevers and that requires them to be hospitalized. The biggest point here is to say, yes, it can be a common cold. Yes, many of you, even unvaccinated, have your cold and you do fine. But there is a large group of people with really bad underlying conditions that need to be hospitalized, even with Omicron. Even in Omicron being less severe, which is likely true, they still need to be hospitalized. That then leads to probably one of the most important points for people to remember is that while COVID-19 can be a common cold, if it overwhelms our hospitals and takes up space that we need to do other things, like people that have heart attacks, people that have cancer, people that need to have a surgery, all of these things, COVID is encroaching on when we know we can prevent it with vaccination, with doing things like masking when we have to do that.
While testing for COVID is encouraged, there's a COVID-19 test kit shortage unless symptoms are serious. Newland says, please don't go to emergency rooms just for testing.
When we know we need to be tested, right, because you're getting sick, if all these people come to our emergency departments, then our emergency departments become testing places when they need to be caring for people that are sick, whether that's because you were in a car accident or not. So the story really has to be, we have to do what's necessary, like vaccination, wearing masks right now, because our hospitals won't take it.
According to the St. Louis Metropolitan Task Force, the Omicron variant is winning in another way. Healthcare workers are drained, and hospitals in the region are dealing with staffing shortages.
Because Omicron's so transmissible, we've had healthcare workers out because of COVID-19, but probably more importantly is we've lost a lot of healthcare workers during the pandemic who's left the field because it's been so hard. It's been so discouraging, and it's just been so hard.